Welcome to mychronicpain.com's blog. I'm Dr. Kent. Today I'm reviewing 5 great tips to improve your doctor's office visits. In today's office visits, it's often rushed and you need to get your problems heard and addressed. So here's some tips to help you get there. First of all, come prepared. Get prepared, get ready in advance. Don't trust that the pharmacy fax the refills in and the medication list. Call and check and stop by the pharmacy and get them if needed. Bring in all your meds, your supplements, your herbal medicines, your vitamins. Make sure the doctor knows everything you're on. Bring in whatever's pertinent to your priority list. Bring your pain diary. Print your online pain diary if needed. Bring your diabetes journal or whatever's pertinent. Check on your lab tests. Do they have them? Do you need to stop by and pick them up? Can the doctor review them? Check on your x-rays and your MRIs. You need to pick them up. Often, if you want to see them, you need to pick them up. Check with medical records, see if they're there. Do the work, it'll pay off. When you get there early, you can have the nurses start addressing some of the questions. They can answer some of them. They can maybe address your refills. They can get your priority list on the chart, and they can really help. Use the team. Use your pain care team. Now be courteous, be pleasant. The healthcare team sees lots of people that are sick, unhappy, and in pain. Pleasant stands out. You'll get better care with a courteous attitude. You'll get better responses to phone calls, and you'll get more help. That's just the way it is. Bring backup, someone that's trusted, someone that you're comfortable with, someone that you can review your priorities with, and they can help you stay on task and get those priorities addressed. Someone that can take notes for you and listen when you're being examined and when you can't take notes. But most importantly, bring someone you're comfortable with. You can always send them out if you need more privacy, but a helper is great. Now, most importantly, communication. This is why you're there. Communication is the main reason you're there. You want to get your priorities addressed, your questions answered, and get things taken care of. You need to be able to listen as well. So get your priorities on the chart. Get them addressed early in the visit when the doctor is in the room. Make sure that you understand the answers to the questions. Ask as many questions as needed. Listen, take notes, okay? Get your helper to take notes as well. And then lastly, don't forget your stuff. Yeah, whatever you brought in, plus more, whatever you now need. You're going to need to get organized. You need to take a moment. Don't get rushed out. Get your referrals, get your x-ray requests, your lab test requests, know where you're supposed to go, know when your follow-up visit is. Don't get rushed. Take a moment and get it together so this visit will work out for you. Okay, so let's review. Be prepared, be nice and courteous, communicate well, make sure your priorities are addressed early on in the doctor's actual visit with you, bring backup, leave with the info you brought and the new stuff you need to take home with you. If you have any questions, you can ask questions through our social media and through our blog. And we do our blogs based on requests, so please send us a request. Thank you. I hope today is a better day. This is Dr. Kent signing off.